virtual fly on the wall in acute care, preparing physical therapy students using 360-degree virtual reality. And just you can go whenever you're ready.
I remember my very first experience working with a physical therapist in the intensive care unit as a first-year student. I remember walking into the room just being completely frozen. There was our patient lying in the bed. He was wearing a cervical neck brace. He had a jungle of lines and tubes coming in and out of him. They were all attached to machines, making beeping noises everywhere. I was just completely overwhelmed. I remember thinking as an Air Force veteran, man, a deployment to Afghanistan is seeming really easy right now. And that's not because I prefer a wartime environment over working in a hospital. It's just because I was more acclimated to it. Now, working or learning in a hospital environment can be extremely stressful. And this is evident in a 2 to 3 week acclimation period reported by students getting comfortable enough before maximizing their learning. This amounts to 30% of a typical clinical experience. So how do we reduce this acclimation period and maximize the student's learning? We propose that early training in the first year of a physical therapy student's education can significantly reduce this acclimation period. Our research is looking at Preality to accomplish this. Preality utilizes a combination of virtual reality headsets and 360-degree video and audio footage of actual patient care. Now, Preality can fully immerse the student into the room in an observational capacity with the physical therapist and the patient. This allows the student to become a virtual fly on the wall, able to observe without the anxiety and fear of disrupting patient care by getting in the way or not knowing what to do. Our research has 2 groups. Our control group went directly into their clinical experiences without being exposed to Preality. Our second group was exposed to Preality and are currently going through their clinical experiences. Now, once the Preality group completes those clinical experiences, we're going to compare the performances of the 2 groups. We hypothesize that the Preality group is going to be significantly or perform significantly better than the non-Preality group because of shorter acclimation periods. Their performances are going to be assessed by the clinical instructors that were overseeing their work. Our hope is that Preality will be incorporated in many different aspects of the healthcare education. One aspect we're looking at is patient empathy. By utilizing Preality, we can give the student a first-person perspective of what it's like to be the patient, how they're receiving treatment, how they're being spoken to or not spoken to, and how people are communicating around them. We believe that Preality can better prepare healthcare providers, which will lead to increased value of care and improved patient experiences by treating them with greater dignity and respect. Thank you.